What are you really, really good at that you would love a million patients tomorrow? And what you really suck at that we don't want to do or refer out or bring another specialist to do.
One thing that I've seen that CDP does really well is they push everything back to the clinical side of things. So like, I'll give you an example of where I see people fall in a pit hole all the time. They'll come to me as a marketing guy and I'll say, okay, what kind of patients do you want? And they'll say, Gary, you tell us what kind of avatar we should be targeting. I'm not, you don't want to ask the marketing guy that, because I'm either going to say all on fours because that's going to generate the most ROI, or I'm going to say, a pedo patient because those are the cheapest leads that we can drive. And those are the easiest leads that we can get our hands on. And if you go, well, I want, bread and butter dentistry, I want, fillings and crowns, neither of those are going to fulfill that. So you don't want to ask the marketing guy what kind of patients you want. You really want to ask the clinical staff, what kind of patients do you want? And a lot of decisions need to drive out from clinical. How do you see that getting twisted around sometimes and people getting in the wrong position where maybe the wrong people are leading some of these dental organizations or dental practices when it really should be the clinical side of things? What are your thoughts on that?
Absolutely. This is a very important topic. If we don't have a very clear understanding on who our target market is, then you make grave decisions. So number one is, as a DSO, our client is the provider that is providing the best ultimate optimal dental care for the patient, right? So we serve the clinician. Now, the clinician, we have to educate the clinician. What exactly are you looking for? What is the mission, vision, objectives, and core values? Who is our target market? And we have to do this analysis, target market analysis, including demographics, geographics, and psychographics. Who is it that we're targeting? And we have to understand them. There is a buying decision process in the mind of those we are targeting. There's the need recognition phase. There's the search of options phase. There's the evaluation of alternatives phase. There's the decision making, and there's the post-decision evaluation. We have to understand and study those stages that make up that decision-making process in the mind of our consumer or our customer, our client. And then we have to do a competitive analysis. Okay, what do the others do that are very successful at and they're not good at? And then we have to do a service analysis. What services are we providing? Yes, now you got the target market. Let's say you're a pediatric dental specialty and your target market are moms from the age of 18 to 40. All right, we have to understand their behavior. What do they do? What do they click on? Where do they hang out? What's their preferences? Because that, at the end of the day, is the decision maker. So we do the service analysis. Okay, do we provide whitening with our pedo services? Maybe the mom will do the whitening. So you have to understand that. And then there's a budget analysis. Yeah, I can spend $1 zillion on a project or a campaign, and at the end, I don't get anything in return. So all this has to be done. Target market analysis, including geographics, demographics, psychographics, competition analysis, service analysis, budget analysis.
Yeah. So and that's great, but most dentists don't know how to do that. So like, how does what part of that is the clinician's job and what part is the support side? Like, where do you draw the line? How do you make that work in the real world?
Great question. First thing is they need to follow or listen to your podcast because they'll learn a little more. Second is I always take responsibility. I feel like it is up to us as a DSO to educate the clinician. What is it that you want? We don't necessarily make the decision for him, but we educate him to the right decision.
Mm-hmm. Yeah.
Meaning, hey, can we write down on a piece of paper, what is your mission? Who is your target market? What are you really, really good at that you would love a million patients tomorrow? And what you really suck at that we don't want to do or refer out or bring another specialist to do. Once really they define that,
yep.
Yeah, we bring that, we help them create that avatar. But at the end, we support them. We're not pushing any treatment on them. We're not pushing a specific clientele. We're just here to support.